I think we may be live. This is how every live starts. I very much hope we're live. If we are, welcome. This is another live Holistic Vet Sisters. We go live for 1 hour every Thursday at 6 p.m. UK time, 7 o'clock mainland Europe. You can watch us live every Thursday, or you can watch the recordings at the Holistic Vet Sisters Facebook page or on YouTube at any time. I have just counted, and this, according to my count, is live number 9, meaning there are 8 recordings that you can find on the Facebook page. I am only me today. Caroline and Tina are not here, so if this all works, I'll be very proud. I am also very proud to welcome Birgitte Langvad. Last week we had Amaya, who was president of the Raw Feeding Veterinary Society, and this week Birgitte, who is the president of IVAS. So we are we're doing well for high-profile precedent guests at the Holistic Vet Sisters. Birgitte, do you want to introduce yourself?
Yes,
welcome, first of all.
Thank you. That was quite an introduction, I must say.
Yes.
Yeah. But in the daily life, in the daily life, I'm just me in my own practice, where I do acupuncture and herbal medicine, Chinese herbal medicine, osteopathy, and I also do some rehabilitation for primarily dogs. I have a water walker, underwater treadmill, and we make a lot of exercises for the dogs who has undergone surgery or just need to be exercised. So, and I live, as you know, in Denmark, and I have this practice, and I'm the only person in that practice at the moment, and I think it will.
You're the boss.
Be like that, yes. So.
Yeah.
And then I have this.
Do most of your patients? Oh, go on.
Oh, that's fine. And then you said about IVAS, which is our International Veterinary Acupuncture Society, where we do a lot of courses and conferences for veterinarians that are interested in acupuncture and a lot of other stuff. So it's actually for holistic vets. So even though we don't have any homeopathy, which you are very interested in, but we have a lot of other interesting things.
I think between acupuncture and homeopathy, those are the sort of 2 main holistic modalities, aren't they? I mean, between the 2 of us, we can treat most things.
Sure. Sure.
I would have thought.
I very often get the question.
Is there a...
Sorry. I very often get the question.
No, go on.
From people what can acupuncture be used for in animals? And I'm sort of, yeah, we could use it for everything. So, and I really mean it. Of course, if it has a broken leg, it would be stupid to just fix it with acupuncture, but afterwards there will be use for acupuncture in regards to swelling and pain and hemorrhage and stuff like that. So it's good for, yeah, I would say anything. So.
How much of your practice is it mostly small animals? How much of it is horses? And
I used to do a lot of horses, but now it's primarily small animals. It's dogs and it's cats, and sometimes I have a hen or a dog or something like that as well, which is really, really funny to have patients like that. I actually had a hen one day that she was attacked by the fox, and all the rest of the hens were killed. But she was not killed, and she had small chickens, and the owner really wanted to do something for her because she was not able to take her head down. She could only stand like this. And then she came with her, and I make osteopathy on her, and I gave her some small needles, and she took her home. Afterwards, she could take the head down, and she could eat and drink, and that was really...
Oh.
Yeah.
That's amazing.
Yes, it is.
That's fantastic. Do most of your patients get needles, or are there some that come for osteopathy and others that where you choose to do acupuncture, or does it sort of melt together?
It sort of melts together because there are, of course, patients that don't like the needles, but it's very, very few. And if you are very careful and use very small needles, it's okay. But when you have a patient that have pain in the neck or pain in the back, it's really nice to could use the needles so they get relaxed in the muscles, and it's easier to work with them afterwards doing the osteopathy. So seldomly, I only use my hands if they are too sensitive or the owner has an agreement with the animal about not giving it needles.
They promised.
Yeah.
The owner has promised no needles.
Exactly, exactly. And they say, I promise you're not getting any needles. No, no, no. Okay, okay, okay. I won't be. So that's really.
I'm just looking because we had some questions and some of them were clearly for you. Yes. Someone called James asks, he has, I don't have all the information, as is always the case with these things, so the answer has to be somewhat general, but he says he has a dog that was recently diagnosed with osteoarthritis in the front legs, and he doesn't tolerate the pain medication. He's currently hospitalized because of bad gastroenteritis from a non-steroidal pain medication. And he's concerned about how he can treat arthritis without medication side effects. What would you, that must be a question for you.
Yes, it is. It is. Many of the patients, they do have osteoarthritis. And I would definitely recommend that he find a veterinarian that do acupuncture. And I would also supply with herbal medicine because obviously the dog can't take the medicine, so it's much better to use some herbal medicine or homeopathy. It's not my league, it's your, but definitely acupuncture and some supplements. That would be perfect.
Yeah.
So,
yeah.
do you
So
know
if
where
James
James
is,
lives?
if he, I don't actually know either, but if say he's in the UK, is there a, are there IVAS, is there a general IVAS website for all the countries, or do you need to find one for, where would he go? Where would he look for an acupuncturist if he's in England?
Yes. If you look at the IVAS webpage, it's called ivas.org. Then you can find a page where all the veterinarians that do acupuncture all over the world, they are listed there. But of course, there are people that are not educated within IVAS. So hopefully they do some advertisement on the internet, or I don't know. I don't know in the UK how it is, but I'm sure there are many vets that do acupuncture as well. So it should be possible to find one.
Yeah. And IVAS, as we keep saying, of course, is IVAS, International Veterinary Acupuncture Society.
Yes.
Yeah. IVAS or Google vet acupuncture or dog acupuncture.
Yeah,
It
or
seems a very good place to
vet.
start.
Yeah, I would do that.
Yeah.
But it
Yeah,
should
yeah,
be
yeah.
possible. And as I told you earlier, there's one in the Isle of Man, so he could go there.
Combine it with a holiday.
Yeah.
If James was near you, when you see an animal for the first time that comes in with osteoarthritis, is there a typical course of treatment, or is it too different from between each patient that it's too difficult to sort of generalize? I mean, how often would you typically start treatment? How often would you if someone comes to you with osteoarthritis, they can't tolerate pain medication, they're in chronic pain, let's go for acupuncture. How often would you expect to see them?
Yeah. In the beginning, I advise people to come 3 times within 7 to 10 days interval, just to see how does the patient respond to the acupuncture. some of the patients, then you can see a difference within 1 or 2 treatments, but some need more. But most of them, they react within only 1 treatment. But after the 3 treatments, I will probably recommend only to treat them once a month. I have some senior patients that come once a month, and they have different kind of osteoarthritis or spondylosis or other things like that. And if they come once a month, it's fine. And sometimes the patients or the owners, they say that, oh, if they come like 5 weeks after the first treatment, then they can see that they needed to come in within 4 weeks. So they can see a difference when the dog actually need a new treatment. So that's all right. I mean, once a month, that's not a lot to come and have acupuncture. So.
Do the animals does it become easier or harder? I mean, do they know that it helps? Are they happy to come in? And if they've been 10 times before, is it easier to do it again? Or is it easier the very first time before
I would
they know
say
what to
95% they are happy, and I give them a lot of treats. It might be the reason why, but they are very happy to come again, and they are not. There are a few that sort of get. They don't like it anymore. But even the very sensitive dogs, they actually take it quite well to get treated again and again and again. I see, I treat humans as well, and I sometimes see that they get more sensitive after a couple of treatments, but
I lost you now. You froze. Are you seeing me as frozen? Can you hear me? There we are. Can you hear me now?
Yeah. Oh,
okay.
We disappeared, but now we're back.
We're back. Yeah. You froze and I lost your sound. You're missing it the same way. Let's ignore it and continue quickly. You were talking about geriatric. You should tell us about your group, because you've fairly recently started a forum for the owners of geriatric dogs.
Exactly. It's called Birgitte Langvad, which is my name, and Holistic Vet Senior Dog Community. And I have made this group for dog owners. It can be veterinarians as well, and there are veterinarians as well in the group. But it was primarily for the owners of senior dogs, because I think we need to have a place where we can meet and we can share. Because in my clinic, I think my clinic is sort of a place where we share wisdom, we share knowledge, we share experience. I mean, so many people, they come in and they have something interesting, and I gather all this interesting information, and I like to share with people what I learn and what I hear. And then I thought about making this group to have a place where people, they can come with their experience about what they do for their old dog. And it could be in regards to books they are reading, or special exercise, or special dietary supplements, or whatever. And it can also be, people can ask questions, they have concerns about their old dogs. And so it's really, really interesting to have this group. It's not as that I'm going to make a lot of posts and make a lot of education on this page. It's sort of meant to be a community where we can share our experiences, and where people, they can be open and they can tell about their dog and what is happening. So yeah.
So it's a free group that anyone with an elderly animal can join.
Yes, exactly. It's not completely open. It's a private group where you can, but you can ask to be invited, and then you get. There's some few rules about, have a decent behavior, and this is not a page for selling stuff or anything like. I don't want that. So I just want to have a place where we can share, because this I realized that I've learned so many things through my long veterinary life, and I actually realized that the things that I know about acupuncture and diet and supplements and herbal medicine and it's all very well suited for the senior dog. So then I thought, okay, why not put all my experience put a focus on the senior dog? Because when as a practitioner, that when the dogs get older, people get more and more worried. They get worried about when is it time to say goodbye? And people are very interested in doing things themselves, doing things that can make the life better for their dog. So they are not satisfied with just going to the yearly visit at the vets, getting the vaccination or whatever they do. They need more than that. So that is one of the reasons why I've made this group.
And is the language in the group is English, or?
The language is English. I have made it an English group so everybody can join from all over the world. I have a lot of people from Denmark, and they write in Danish, but the prime language is English.
I suppose these days Facebook sort of translates for you anyway, doesn't it? Sometimes
Yes,
it offers a translation, even though it's sometimes a bit clumsy. Okay, well, if it's okay with you, I think we should share the link for your group when we post this at the end of this video, so that anybody who's interested can apply.
That could be so nice. So nice.
Yeah. Okay. Well, that would be a lovely place to continue the conversation in your group. That would be nice. Perfect. There was another question that, because I'm now on this screen, I can't actually read the question. I didn't write that one down, but Ange was asking about incontinence in an elderly collie, spayed female with urinary incontinence.
Yeah.
And she wrote that cystitis has been ruled out.
Okay. And
what would we suggest?
Yeah. I recently had a patient like that in my clinic. And I have treated it with acupuncture, and I have treated it with herbal medicine. And it's a 10-year-old spayed female, and the incontinence has completely vanished.
Wow.
Yeah, that was quite amazing. And I've had these patients before, and I really have good experience with using acupuncture and the herbal medicine together. So don't give up on that one.
Yeah. I think that should be the headline on everything, everything we say, really, because so often, there's so many situations, whether it's the geriatric animal or whether it's a chronic condition like incontinence, or, I mean, it's a very long list, where people are told by their vets, there's nothing more we can do. This is it, which is true when they're talking about the tools that they have at their disposal. Within conventional medicine, we've done everything, there's nothing else we can do. But the sentence just shouldn't end there, because so often, if you see a veterinary acupuncturist or a veterinary homeopath or a veterinary osteopath or whatever it is, it turns out that cure was possible, or at least the condition could be managed in a way that, there was very, very often, in my experience, I see people when they've been told that there is nothing more that can be done, the situation is now hopeless, and then we just treat them with a different set of tools and a different method, and suddenly improvement or cure was very possible. So I would even say to anybody with a sick animal, don't give up unless you've tried another approach. See an acupuncturist or a homeopath, or see a vet that has a different skill set. Yeah,
Yeah,
don't give up.
exactly. Yeah.
That's a really good message.
I'm treating a Cavalier King Charles Spaniel at the moment. It's only 4 years old and it has a heart condition and it has worsened and she's really, really worried and it's tired and it's on medication and from university. But she has been at my place before with another dog and then she came with this little dog and I thought, okay, I'm just going to treat it with acupuncture because that's what I do. And she came the second time and said it was completely full of energy and the energy has just gone up. I told her that the dog would probably be more tired after the treatment, but she said it has been running around, playing, and completely different. And some of these cases, I really get amazed of the effect of acupuncture. So that's really nice to be able to make a difference on that kind of dog because we know it's only going one way with a dog like that. So yeah.
Yeah, and it's amazing, I think, as a vet, because I mean, we've all worked in the conventional veterinary world, and conventional medicine is amazing for some things. But it's amazing when you know the limitations to then work with a different modality and just find out that, every day when I drive home from work, it's like, that wasn't supposed to be possible. That's definitely impossible what I saw today.
But
That
isn't it just
doesn't get better.
wonderful?
Yeah, no, absolutely.
I
Absolutely.
really love
It
it.
is. Yeah. So you would say for someone, I mean, female dogs, we know that neutering dogs, we've talked a lot about neutering in these lives that we've done because neutering is something that we're not doing anymore. But obviously, lots of dogs have been neutered. And we know, and we have known for a long time, that as many as 1 in 5 female dogs develop urinary incontinence directly as a consequence of having been neutered. So and there are conventional treatments that you can give, but it's good to be aware that there are also holistic treatments that you can give
Exactly.
instead of or alongside, or if the conventional treatments don't work, you can try acupuncture or
Yeah.
homeopathy.
Yeah.
Again, it's don't give up. It's the main message, isn't it?
Yeah.
There's lots of things that can be tried.
Yeah, exactly.
What sort of conditions have you got? Any conditions where you just really wish that everybody knew about acupuncture or
Epilepsy.
so on?
Epilepsy.
Yeah.
Yeah. I use acupuncture, but I believe that the herbal medicine is the most important thing in this disease. I have had so many patients that have been treated with conventional medicine, um, but they still have seizures. But when I put them on herbal medicine, and gradually take the conventional medicine away, they stop seizing, they stop having the seizures, and are doing just fine. And then I talk with the owners about the diet as well, because according to traditional Chinese medicine, there are some factors that we talk about wind and dampness in the body as part of this epilepsy and seizures. So we want to get rid of wind and dampness, and that we can do with different kind of herbal medicine, and it works. It works. I'm so amazed about it. I have had so many dogs gone through life with only herbal medicine and no attacks. Isn't it
That's
amazing?
fantastic. Yeah, no, it is. It is. And that's how you work at the end of the day, isn't it? Isn't that amazing? It really is. So if there was one condition where you could magically make sure that whenever a vet diagnoses this, they say, you need to go and see an acupuncturist or someone educated in Chinese medicine, it would be epilepsy.
Yeah, definitely. But I can mention a lot of other diseases as well, but
Sure.
epilepsy is really because I'm so amazed about it. When I learned acupuncture, in 2006, we had a teacher in Canada, from Canada, and he was doing herbal medicine and acupuncture and stuff like that. And he treated animals and humans, and I wanted to do the same, so I went to see him in Canada. And the first thing that I met was exactly that, his wife, she was a vet as well, she said, but we are treating epilepsy dogs with herbal medicine. I was sort of, what? Yes, and it works just perfect at acupuncture as well. So that was the first time I heard about it. So, and then I tried it here since then, and it really works well. So, yeah.
Fantastic. Is it possible to talk about dietary advice for epileptics specifically, or would it depend on the presentation in each individual case, what you would advise about diet for an epileptic patient?
If we go into the thinking about the philosophy about wind and dampness, there's a lot of food for dogs that creates a lot of dampness. We know that carbohydrates, they make a lot of dampness in the dog. And that's why we see eczema, allergies, and we can see epilepsy and a lot of other diseases. So we have to get rid of the carbohydrates for one thing. So, and I mean, there is a tendency, thank God for that, that the food is without carbohydrates, but there are still people that are just giving any kind of food to their dogs. But I always try to get people to feed them either raw or just at least some food that they have prepared themselves, or take find some kibble that are without carbohydrates, but we still have this ultra processed food in the kibble. So I prefer to give them either home cooked food or give them raw. Some of the dogs, they cannot take the raw food, and they actually make more dampness getting the raw food. But it also depends on their age and their type and stuff like that. But in general, they should limit the carbohydrates as one thing. So, but I guess you have talked about carbohydrates before in one of your...
Yes, I mean we talk. I think we're all quite strongly in favor of feeding dogs real food. So we
Yes.
talk quite a lot about a lot about food. It's bizarre when you think about it that I mean it's been discussed in the press recently how people should avoid ultra processed foods. You know, that we should eat things that are not highly processed. We should eat in a varied diet, maybe an organic diet. But when it comes to dogs, most vets will recommend an extremely, I mean, as ultra processed as food could possibly be, is still what many vets recommend that dogs and cats should eat. And it's just does not make any sense at all, does it really? Why should dogs do better on ultra processed foods? And we know that they don't. So yeah, we talk quite a lot about that. That is true. I must say, it's hard to say this without being misunderstood maybe, but I mean, I've been recommending raw for 30 years. Always, and I think that animals should eat real food, but at the same time, at the moment, it's become very fashionable or trendy, or lots of people are feeding raw, which is great. But I do sometimes meet the expectation that if you feed a raw diet, you can cure your animal of everything just by feeding a raw diet, which I also think is a slightly odd assumption. Feeding raw doesn't cure everything in itself. No. But I do get people asking, how should I tweak my dog's diet to cure this or to cure that? Where I'm thinking, well, I think they need more treatment than just a good diet. But a good diet is obviously a nice place to start.
Yeah.
Absolutely.
But I've also heard that about that if we only just feed raw, everything will go well. But I find that there are dogs that cannot take the raw food, that it's too, if they are very low in energy or if they're elderly, it might be a problem to process the food and get the energy out of it. They use more energy to process it that they get out of it, sort of.
Yeah.
So,
Yeah. No, absolutely. I think that's the first. I mean, that's a part of looking at things holistically, isn't it? That there is no one size fits all. There isn't one thing that's ideal for everybody,
no,
not even everybody with the same diagnosis.
no,
You need to look at each
exactly.
individual,
Yeah.
yeah, and find the right thing for them.
And
But real food is, go on.
that's the wonderful thing about holistic medicine is that we look at the individual. We don't look at the dog with a diagnosis. Um, and that's so nice being a holistic vet because people they can see that we are really interested in their animal and we want to do the best for the animal, not just see a diagnosis and then just take some medicine. So it's yeah, being a vet, it's so much nicer to be a holistic vet.
Oh no, it is also because you need you get the long consultation. You need the long consultations, don't you? Because you need the information about your patients.
Yes.
Yeah,
And you
absolutely.
get all around the dog, and you get a lot of different symptoms within the same sort of, yeah, not diagnosis, but still, I tend to call it a Chinese diagnosis. So where we sort of get everything within, and then we can treat it. So
Yeah, you need the big picture, and you need to know the animal. You can't just say this is a case of this, so I know what the treatment is. You need to take the time and understand each individual, which is it's a nice job to sit and talk to people about their animals all day long. It's the best
and they
job.
like it as well.
Yeah, yeah, yeah. The only downside, if you can call it that, I find, is that I get lots of people contacting me saying my dog suffers from itchy skin conditions, or my dog has epilepsy, or my dog has whatever. What do you recommend that I do? And the only answer you can give is I haven't got a clue because I don't know your dog. You know, we need the consultation. You don't know just from the diagnosis what the treatment is going to be. You can't skip past the consultation where you get to know the patient. So there's only so many animals you can help in a day, I suppose, is the downside.
Yeah.
How long is your consultation when you have a new patient?
It's 1 hour.
Yeah, yeah.
It's 1 hour, and then the second time it's perhaps 45 minutes. It depends.
Mm.
But it's the same with the Chinese herbal medicine because I've often been met by the question of, oh, I have a dog that has diarrhea. Do you have something?
Yeah, yeah.
Or I have a dog that is very afraid of loud noises and stuff like that. And I've heard you treated another one. Couldn't I get some of that stuff as well? And I'm sort of, no, I'm sorry, you cannot. Because I haven't got a shelf where it says diarrhea or where it says afraid of loud noises. So people, they need to understand that it's
Yeah,
individual therapy. But very often they don't like that idea. I think it's because it's possible to go to a conventional veterinary clinic, and then they can look at the shelf, and then they can find that stuff that is just for diarrhea or anxiety or whatever. So I just say no. You have to come to the consultation, and I would definitely like to help you, but I have to see your dog.
yeah.
Yeah.
But that's a really important point, I think, what we're talking about right now. I would even say that maybe it's the main difference between conventional medicine and certainly homeopathy, but I think it goes for most holistic treatments, if not all holistic treatments, that it's not just, what kind of medicine you use, it's how you approach the case. That when you treat conventionally, you have a diagnosis and then the treatment follows. The sort of details about the patients are not really relevant in choosing the treatment. But
No.
when you treat holistically, you look at the patient and you need to understand that individual patient. So you could have 100 patients with the same diagnosis, but give them 100 different treatments.
Yes, exactly.
Yeah, but it can make you sometimes it can be a hurdle. It can be difficult to communicate about that. I mean, I've had a couple of situations where vets have called me, and I think that's very admirable. You know, I had a woman call me a couple of years ago, a colleague who didn't know me at all, and she had had a patient with cancer, and she had told the owner, you know, go home over the weekend, say goodbye, come back on Monday, and we'll put him to sleep. There's absolutely nothing we can do. And then 3 years later, she sees the dog in the park, and she was completely shocked. She just assumed that it had been euthanized by an emergency vet during the weekend, and that's why I didn't see him back. And she talked to the, obviously the thing to do, you know, I wouldn't have thought that was possible. I diagnosed that dog. I knew it had a huge liver tumor, not supposed to be able to live. Please tell me what you did. So I started a story about holistic medicine and homeopathy, and he doesn't, you know, she didn't have the time for that. She just, sure, but can you just spell what you gave? Because next time I get someone with a liver treatment, clearly I'm going to give, with a liver cancer, clearly I'm going to give them that treatment, because that's amazing. You know, I just want to write down, maybe you could send me a link, what the name of it or where I can get it. And it's difficult to communicate in that situation, because someone really wants to help their patients, and they want to, you know, benefit from something they want to learn, and at the same time it's just like, we're not speaking the same language. You're not hearing me.
Yeah,
It depends on the patient. You know, next time you have a patient with cancer, send them to me, but I can't tell you what to give them. So it's, don't you get that frustration sometimes, that it's like, sometimes people can almost be like, you don't want to, just tell me what to get. I don't mind paying, but tell me what I should buy and where I can get it, because I want the results that my neighbors had.
Yeah.
And is that you have to take the time, and you have to understand the patient, and you have, in a way, you have to start from scratch with each new patient, don't you? It's so the amazing thing is that you can cure things that are incurable per definition almost. But the downside or the challenge sometimes, I think, is that you can't make it easily available. No, because you need to spend the time with each one.
Yeah. I actually had it with the epilepsy treatment that I think it was the owner that actually said, "Oh, my vet really want to know what kind of herbal medicine that you are using for epilepsy." And I was sort of, but it doesn't work that way. No, but she just want to know what kind of herbal medicine it is. I'm sorry. So,
but it's
the
exactly
same
that.
With some dog owners that came and say, "Oh, it helps so much on that dog. Couldn't I get the same one?" "No, you can't, but you're welcome to come to the consultation." And then 1 month later, she said, "Oh, that herbal medicine, is that possible just to buy it?" "No, it's still not possible to buy it. But I really want to help. It's not like that. It's not that I want to get people scared of me or anything like that. But they just need to understand that I don't work that way." So
yeah, and it can feel like you're withholding.
Yeah.
when that's really,
yes, exactly,
really not what you want to do. Yeah, because it's not a medicine for a condition or a medicine for a problem. It's a medicine for an individual.
Yeah.
And a different individual with the same problem needs a different treatment.
Yeah,
so it is a completely different, it's turning everything on its head, isn't it? It's a different paradigm. And that's the difference, I think. I think that's the difference between conventional medicine and holistic medicine.
Yeah. And I'm really
that
glad that you were saying this, because I so often experience it and thinking, oh, maybe I'm just too stiff. Couldn't I just give them some herbal medicine and then they will be quiet?
Yeah.
So it's nice to share that we have same challenges.
Yeah, the same frustrations sometimes, and the same feeling of getting stuck when you want to help and you want to communicate, but it's like it's two different languages sometimes.
Yeah, exactly.
And I find that colleagues will say, you know, have you got a good remedy for whatever? Have you got a good remedy for a problem? And I'll say, well, yes, but I can't tell you what it is, because it'll be a different one for each patient. Yeah, that can be a hurdle sometimes, for sure.
Sure is.
Yes. Let me just find another question. Time flies. Let me see if I can excuse me for a second. I think this is probably a Danish person, so I'm going to pronounce it Irma, asks about dogs and anesthesia. Is it normal that it can affect the dog's stomach long after, 1 month after? How can I help my dog get stronger again? Her acid reflux has started again after the anesthesia, after more than a year's break. So if I read that correctly, it's a dog that used to have acid reflux problems. I don't know whether it was vomiting or, well, I don't know, vomiting, burping, lip smacking, whatever that might be. And it went away for more than a year, and then they had a general anesthesia, and now it's back, even though the surgery or whatever it was is a month ago.
Yeah.
What would you say?
First of all,
There's always
first of all, I would say that yes, they can have stomach problems up to a month after or longer after surgery or anesthesia. Some of the dogs, they really don't tolerate the anesthesia very well, and I see dogs that have problems for a long while. And regarding the reflux, as an acupuncturist, I would definitely suggest acupuncture. It's just because when we are having reflux or vomiting, we say that the stomach energy is going in the wrong direction. It's supposed to go downwards, but it's called rebellious chi, so it's going the wrong way. So we have to sort of tell the stomach chi, the stomach energy, to go downwards. And that's really easy to do with acupuncture, to do with needles. But there might be other problems with the dog that she's not aware of, or the veterinarian hasn't seen, I guess. So it might be more complex that she is just saying in her question. What do you think?
Well, I mean, and we don't know how old the dog is, and we don't know why there was a procedure that needed anesthesia. So there is some information that we don't have, but I think it sounds like good advice. Find an acupuncturist. Maybe, again, without offending anybody, we should talk a little bit about, there are different approaches to acupuncture, isn't there? I mean, I did an acupuncture course many years ago that I kind of regret doing, because it was a Western approach to acupuncture. So it was what I today call, rudely I know, called cookbook acupuncture. You know, if your knee hurts, put the needles there. If your toe hurts, put the needles there. And I think it actually relates to what we were just talking about the difference between holistic medicine and conventional medicine, about treating the problem or treating the individual, that people with the best of intentions will try to cut corners to make a treatment easier and more available. And that happens with acupuncture, and it happens with homeopathy, that you try to sort of mix two worlds that can't be mixed. So you try to take acupuncture or homeopathy and apply it according to conditions. So you try to use these tools in a conventional way, which becomes, which is a shame, I think. And it sort of takes away some of the power of these treatment forms. It's, you know, so it certainly happens with homeopathy, and it always upsets me that people will talk about homeopathy for a certain condition, which is a nonsense. You just cannot talk like that. But still, in an effort to try and make homeopathy easier for everyone to use at home, it's sold like that sometimes.
Yeah. And it's the same with acupuncture, because if you want to have more veterinarians to do acupuncture, they make sort of easy.
But sorry, that was a very long rant. Acupuncture can, yeah.
Okay. It's just, I think, to get more veterinarians to do acupuncture, or doctors as well, short courses are made where they have something they can go home and do some acupuncture, and then something for the elbow, something for the knee, something for whatever, the back. And it's easy but it's cookbook acupuncture, as you say. And the thing about that is that it doesn't last. You don't get the proper treatment. It's like a symptomatic treatment, like taking some medication for a short while and then it works, but then it doesn't work anymore afterwards. The way I learned acupuncture was learning all the philosophy behind it, the traditional Chinese medicine philosophy about where they use a lot of metaphors about wind and dampness and heat and whatever, and yin and yang and qi and all that weird stuff that many academics think is just nonsense. But if you really get into it, the core of it, and you get to understand it, and you can put your symptoms into this pattern, it just melts together and gets so beautiful. And then you are able to treat anything, because on a cookbook acupuncture course, you would not learn how to treat allergy, eczema, or heart conditions or something like that. So it's so much difference, and everybody should learn traditional Chinese medicine. And the thing is, when I have a new patient, when I have any kind of patient, I always feel on a dog, and then I find the points that the dog should be treated in. And it's not with my brain, this is with my hands and my intuition. So I can feel which points need, they can be deficient, or they can be hollow, or they could be warm. And then I treat them. And then afterwards, I think, okay, which point have I actually put a needle in? And then so I sort of do it backwards. So then afterwards I can see, okay, this point on the back, that's the alarm point for the liver. Interesting. Why do we have that point as an active point? And then there could be a kidney point, or there could be something else, which tells me a story about the dog, or reveals something that I didn't know when the owner told me the story of the dog. And this is the beauty of acupuncture, doing it that way, where you sort of feel, and then you can use some points with your brain, I mean, but still, the docs tells you which points you should use. So easy peasy.
I think of it as a sort of language that I mean the way that you would analyze a patient, I would think of it, I'm interested to hear whether you agree, but I think of it as a sort of language that describes the imbalance or the patterns, or the patterns, the way that organism or that individual works, but also where the imbalances are.
Exactly.
And then whatever's wrong with them is just the symptoms or the manifestations of those imbalances. But if you know how to read them and how to decode, how to, then whether you talk about wind and damp or whatever, it's kind of the language, the pictures, the language, the images that describe the imbalances, isn't it? So you really understand the patient, which is why it's so beautiful and so interesting.
Yeah.
You understand why they have those symptoms.
Yeah. And I also use to feel the pulse. And we have organs at the different places on the pulse, and the volume, and a lot of other stuff. And then we look at the tongue, and sometimes the tongue really reveals things that you sort of, where did that come from? It's the same in humans. You suddenly have a tongue that is swollen or something, and you thought, oh, that's a sign of dampness, but where do I see the dampness? She hasn't told me anything that could sort of reveal dampness. So it's so great to have all these different things that you could look at. And I also think about the mental status of the dog, as you do, or the animal, to put it into the whole picture. It's so interesting. It's so much more fun than just vaccinating or teeth or whatever.
Absolutely.
We
You
don't
get to know your
vaccinate.
patients much more. No. But but you, I mean, it's the challenge, as I was saying before, but it's also, of course, the beauty of it, that you can't treat without really, really knowing your patients and getting to, you know, having that privilege of getting to know your patients and their families so closely and so well is, I mean, it's an amazing job, isn't it? It's I think we can agree on that.
Yeah.
Is there anything you would like to, I think I was going to ask, is there anything that you really want everyone to know? Anything you really want everyone to say? I suppose I've already heard you say two things. The first one is never give up, don't give up. And the other one is if your dog has epilepsy, see an acupuncturist. I mean, that's quite a strong message.
Yeah. But
You think about if there's,
I don't know.
is there
But
anything?
still, as I said in the beginning, you can use acupuncture for anything. It's not only for pain, because during the time where acupuncture got more and more accepted in society, it still is just for pain patients. Like in Sweden, you're only allowed to use acupuncture if it's something with pain.
Oh,
But you can actually use it for anything. And it's, I mean, my first patient, while I was still studying acupuncture, it was a dog that had elevated kidney enzymes, and she was told by her vet that it's to put it on a special diet. And the dog had allergy as well, so she didn't want to put it on a diet. And I talked with her about acupuncture and said, I'm quite new at it, but let's try it. And I treated it a couple of times, and then we took some blood samples, and then the kidney enzymes were normal. So isn't that just wonderful? I mean, and that was in the beginning where I was quite new at acupuncture, and I was sort of, whoa, it actually can do something that we don't imagine that it can. So no, never give up and seek an acupuncturist.
yeah. Never give up unless you've tried acupuncture and
Yeah,
homeopathy.
yeah.
Yeah. Yeah. There was one more comment. We talked last time about I was sharing an article that's been appearing in the press. I could see certainly in the UK in the last week about a study that showed that the front line and, you know, these drugs that we use against fleas and ticks, and that they are just polluting rivers. This study was showing that they were found in, they looked at 103 birds' nests and they found frontline in all of them. So, and the conclusion of the article was a comment by the president of the BVA, the British Veterinary Association, saying we need to move away from this blanket so-called preventative treatment, you know, trying to treat animals that don't have parasites so that they don't get parasites is slightly crazy. And certainly for worms, this doesn't happen in Denmark, but it happens in lots of other countries, including the UK, that dogs are wormed regularly, even though they don't have worms. It also happens with flea and tick prevention, and I think for fleas it's complete overkill. But what I wanted to get at was that Anna commented that what she worries about is the ticks, and I completely agree, because I think ticks is the one parasite where you can't always just say, well, just treat if they get them, you know, because ticks can actually carry very problematic illnesses that we see in dogs. I wish I had something I wish I had a product I could sell you all that would solve the problems with ticks, and I'd be a millionaire and we'd all be happier. But I don't think there is a simple answer to the tick problem. My experience is that it varies enormously according to where you are. Even sort of, you know, I mean, geography makes a huge difference, but also just a couple of kilometers in one direction or another, there can be lots of ticks or there can be very few ticks. So the first thing I would say about using chemicals to prevent ticks is that only do it if your dog actually gets ticks. I see little dogs that have never had a tick in their life being given, you know, very heavy duty treatments continuously just to not get ticks. And I think that's completely, I mean, hazardous, really. and I think I think it's about the balance between what are you most afraid of, the chemical or the tick-borne diseases. And at some point it tips, not ticks, and then I will use the chemicals. But it's, in most places, it's not a year-round problem. You can reduce the ticks by simple measures like keep your grass short. At some point I had this idea that I was going to have this, wildflower meadow for a garden, and that was very quickly cancelled because everybody got ticks. If you keep the grass short, maybe walking the dogs in the forest in the summer is a bad idea. If maybe you're able to walk them on the beach in the summer, walk them in the forest in winter, or try to manage the exposure as much as you can to reduce the amount of toxic chemicals necessary. I don't think it should be the aim of tick prevention to never get a tick. But if you're suddenly getting lots and lots and lots of ticks, then it can become unsafe. So I think it's really looking at each individual situation to try and answer, Anna saying, but what do we do about ticks if we don't use the chemicals? I think it's a matter of trying to use the chemicals as little as possible. And also with ticks, if you have a Chihuahua, you'll see the ticks and you can remove them. If you remove the ticks within the first 24 hours, they're very unlikely to transmit diseases. But if you have 5 Newfoundland dogs, then that's not going to be realistic. So I don't think there is an easy answer to ticks, but I think we should try to minimize the chemicals that we use.
That's true.
What do you say about tick treatment?
Personally, I'm more afraid of the chemicals than the ticks. So and people, they always ask me, what do you use? And I say, I use these ones. So, but I know it's a problem some places, and people get very afraid. And people, they find different kind of oils or flower essences that can help to reduce it, or different kind of colors to reduce it. And it works on some dogs and it doesn't work on other dogs. So I don't know. But I'm not the chemical type. So
no.
And
I think that's the best. If you can check your dog after every walk and remove them, then that's definitely the best approach.
Yes.
I absolutely agree. And it's the sort of thing, if you see a tick, remove it straight away. Don't wait till you get home and you've got the right tools or someone else who's better at it or whatever. Remove it straight away. That's the best advice. And don't remove them by I've heard all sorts of crazy things, cover them in gel or put things on them, or that just stresses the tick and makes it more likely that it's going to transmit some disease. Just pull them off, twist them off, pull them off, whatever your tactic is, but take them off straight away. That's the best piece of advice. Yes, I agree. Fantastic. I just wanted to answer that last question. Thank you very much, Birgitte, for joining us. We're going to put your geriatric dog group on the Holistic Sisters Facebook page. And don't give up, see an acupuncturist. That's got to be the motto of the day. Thank you, everybody.
Thank you so much for me having be a part of this.
Thank you for coming. Thank you for being here. You should come back and meet Caroline and Tina on a different live. That will be amazing. Tina needs to meet you so you can talk acupuncture together. Next week we got Vicky back, and let me just unlive us if I can do